Okay, so race and addiction. Why don't we just briefly start from left to right, name, affiliation, and thank you for being on our panel, everybody. Okay, go ahead.
My name is Jermaine Atkins. I'm the board vice president for Washtenaw County Families Against Narcotics. I'm also a board member of the Michigan Association of the Treatment Core Professionals and a person in long-term recovery.
Hi, everyone. My name is Crystal Reyes. I think I did this already, but I'm also a person in long-term recovery. I'm a wife, the mother of 4 boys. I'm also a substance use clinical therapist, along with a PhD student.
Thank you.
Thank you. Hey, everyone. Glad to be here. I'm Jasmine Steele, medical social worker for IHA Trinity Health, academic internal medicine, limited license, master's social work. And I'm also a person in long-term recovery, otherwise known as a grateful recovering addict. And I'm so glad to be here to represent as an Arab person in Washtenaw County, so we can start opening up this door and have this conversation more.
Good evening, everyone. I'm Derek Jackson. I'm the Director of Community Engagement at the Washtenaw County Sheriff's Office. I'm a social worker who became a police officer. You can catch me in the parking lot. We can talk all about how that happened. And I'll share a little bit of my story a little bit later, but like many of you, Mario came to visit me and my team several years ago with
Over 4 years
ago, talking about this idea.
Yeah.
And not just this idea of fan, but talking about this particular topic. And so to see us now here at this table, Mario, I just wanted to thank you publicly and say I'm appreciative of being here.
Yeah. And before Dr. Vereen, just the reason I reached out to Derek is I knew he was always willing to listen. And at our very first meeting at the 242 Community Church, we reached out to about 2/3 of the people that were there, and there were over 100 people there. And we asked for feedback. And, everybody said, yeah, great meeting. This is going to be awesome. It's about time. But then there were a few people that said, I didn't see anybody of color in your audience. And I said, there's no way. Are you sure? And he said, look, this individual said, I stood up and started looking around and I didn't see anybody. I didn't see any Black folks. I didn't see any Latinos. I didn't see anything. And so we got that feedback from another person. I called 1-800 Derek Jackson and I said, I got a problem. We don't have anybody of color coming to our meetings. And I remember it like it was yesterday. He said, you want to talk about that? And I said, yeah, I want to talk about it. And he invited me to his community outreach meeting. I called him on like a Thursday and he said, be here at Monday. I know it was early in the morning. And ever since then, we started getting people of color to our meetings. So thank you, Derek. Okay. And Dr. Don Vereen from the U of M School of Public Health, you go ahead and.
I'm Don Vereen. My first credential is I'm a friend of Mario's. Mario sets a great agenda and asks us all to share what we know. I'm a physician trained in psychiatry. I have a background. I have all this academic stuff behind me, but tried to use it to get a research juggernaut going on treatment and prevention in drug abuse and addiction at NIH. Somewhat successful at that. And I have a background in drug policy, trying to put in place the kinds of things that we're going to be talking about tonight. When you see numbers, what do you do with them? How do you think about them? And this is something I've dedicated my whole life to. And I'm very proud and very happy to be with all of you tonight.
Thank you. And Rita from the HHS. There you go, Rita.
Yeah. Hi, everyone. Glad to be here over Zoom. Sorry to be the the talking screen in the background. I am really grateful to be here. I manage the opioids and emerging drugs unit at MDHHS. So I oversee a team of epidemiologists and analysts who all work with substance use disorder and overdose related data sources. We are all passionate about our work, excited about data in action, and exploring ways in which we can help. So looking forward to chatting tonight.
So we're going to start with the presentation, and Rita, are you going to pull up your data and give an overview on your information?
Yeah, it's up to Brandon. What do you want me to do? I've got my slides up and I can share screen, or I can.
Go ahead and share.
Okay,
Rita, you drive the bus on your PowerPoint.
that sounds good.
So we see that data, and we saw that at Families Against Narcotics. Okay, so it's a fact. What are we going to do about it? Okay. That's why we're here. I said over a series of discussions, and the people that are zooming in and the people who are streaming on Facebook, the goal is to implement actionable steps. And I don't know what they are right now, to be honest with you, but we don't want to sit and do nothing when we know that this is happening. So with that, Dr. Vereen, you want to just kind of take that talk for a few minutes, and then we'll get to the panel. When you see that data, and I want you to know, was very intentional that I reached out to Dr. Vereen. He explained, a little bit about himself, but in addition to being with the U of M School of Public Health, he's very passionate about this, and you live about 2 blocks away too. Not that that has anything to do with this, but it was easy to get here. But that's not why I reached out to Dr. Vereen. I reached out to him because he cares about his community, and he cares about doing something about the data that Rita just articulated. Okay. And with that, Dr. Vereen. Yep.
Let me just also add, thank you, Rita, because when Mario asked Don, we need to do this program, these rates are horrendous. And my first thought was, and I didn't share this exactly with Mario, yes, there we go, was that first of all, the state of Michigan has this data available. What Rita was explaining is that you can go and actually see this data and deal with it in real time. And so that is not a small point. It's not a small point. But that leads to the next point. And these numbers that Rita has presented, they tell a story. And they're telling the story about people. So those numbers are actually people. And there's a problem with that. I can tell you from working in drug policy, oh, the drug rate went up this year, or it went down this year, or it went up for this group or down for that group. And that's the end of the discussion. So numbers can be a little tough to talk about. So's race, so's ethnicity, so's sex, I mean, boys and girls, the differences. But we have to talk about them. We have to be able to talk about them. And so Rita and the state of Michigan has done all kinds of work to see this and to say, hey, alarm just went off. We have a problem, Houston. We have a problem. So what I wanted to do was, in terms of giving an overview, is that don't be afraid of the numbers. Don't be afraid of the data or the graphs. You see the trends and you kind of go, okay, what does that mean? Let's go to a fan meeting and talk about this and to understand it better. those numbers are going to help us figure out what to do next, how to prevent, how to treat better. The other thing these numbers and all of this epidemiologic work does is it's telling us a really, really important story that has a beginning, a middle, and an end. Now, there were a couple of people who talked about health disparities. So you're taking a point in time, some group is in worse shape than another group. That's what disparities are. That's what they're about. And we tend to focus on the negative disparities. So if you've got the most of something, that's when we tend to pay attention. And we're not going to talk that much about stigma, but you know, when Black people have the most of something, it becomes a Black disease. It's a Black thing. Well, when the opiate crisis was mostly white people, we didn't say that was a white thing, but it was, and it still is. So the same discussion that we could have had 10 years ago that we're having tonight, we should have had 10 years ago. In fact, we sort of did, because we were trying to understand who was vulnerable. Those numbers, who were they? What were they doing that they died? Where were they? When did this happen? How did this happen? Those are the questions that you ask to bring life to those numbers. And the exercise tonight helps us, because it's very hard to talk about race. Mario was saying, hey, we gotta talk about this. We gotta put this out there. So this gives us the opportunity to do that. If we could advance to the next slide, I want to show or illustrate that just because you see a disparity, it's not always the negative disparity that you want to talk about. And sometimes you find some surprising things. This doesn't show a disparity. This is just the rate of drug use of seniors in high school in the United States for a much longer period of time than the series that Rita was showing. And I just wanted to illustrate that these numbers, these trends, whether it's an epidemic or whether it's a drug use trend, it changes over time. It's alive. There are increases, there are decreases. When there are increases, we need to be talking about why there are increases. When there are decreases, we're supposed to be talking about that as well. This was a number, or these data points. I was asked to talk about them at one point when I was working at the White House. And I said to myself, you know, Asian Americans, Asian seniors in high school rarely use drugs. Native Americans, especially out west, they're much higher than this average number. So I asked the folks at the Office of Management and Budget to take this data and put it through a prism, just as Rita did, to show us these differences. And so we could talk about them and then try to understand them. So the next slide is what we see, the three major racial and ethnic groups. For statistical reasons, Asians, which are still very low, are not on this graph, and Native Americans are not on this graph. And at some point, we may talk about Arab Americans who are considered white. They're buried in the white numbers, the top line here. But why this was so important to me, and I wasn't sure that this was the case. I just knew that drug use among African Americans early on was very low, but I had not seen any numbers. But it increases over time so that people in their 20s and 30s, the rate for African Americans is much higher. But the point I want to make here is that for African Americans, the low blue line, that is statistically significantly lower than everybody else using drugs, with the exception of Asians who are seniors in high school. That is not what most of us would have expected to see. And the same question, I'm going to grab you in just a second. Well, why is that? Was an important question back in 1998 as it is today. So the positive disparities are as important as the negative disparities. So why is it that the overdose rates for whites are better now? The answer to that's going to help all of us. Why is it worse for African Americans right now? Why is that overdose rate worse now? Answers and thoughts about that are going to help everybody. I think what's happened is that vulnerabilities have changed. The environment has changed. And the epidemic itself may have changed. But in what ways? And that's what we can have a discussion about. So I'm going to stop there. And sir, you had a comment or a question? Yes. Yep. Yep. Yes. Very good point. There are many of those things have been explored. And as you can see, this, I brought the wrong slide because I've got this going out to 2020. And I'm going to make another a point about that. But the people who do this study, actually, it's done by a group at the University of Michigan for the United States. The group that does this is actually based here at the University of Michigan. There would be stigma. One of the things that they've said is there would be stigma for all groups because kids don't want to admit that they're using drugs.
I believe, correct me if I'm wrong, that in the Black community, there's more of a stigma for being gay than in the white community.
Yes, but this is about drugs, though. Oh, okay.
That stigma as well
Yeah.
here. And I just throw it out because it's self-reporting.
Yep. That is you're pointing out a really important point about self-report. But let me just add another point here because they've been looking at this for years and years and years. The stigma that you're talking about is the most intense in Asians. And they're the lowest and actual drug use. When you look at rates of hospitalization for overdose and use and arrests and things like that, there are some other disparities that point out the picture. The other thing I'm going to add is that with these numbers related to, I wanted to say 2 or 3 things at the same time, and then they all went away.
This thing is how the trend more or less moving the same direction.
Yes,
For all the groups.
and that argues against the stigma thing because it's consistent over time. So if it's there, Very good observation. If it's there, it's affecting each group consistently the same over time. And it washes out, but that doesn't mean it's not an issue. The other thing that I want to point out physically here is the following. When there's a decrease, they're all decreasing, with the exception here in the middle, some things were happening in the Latino community, and we don't know what was happening there. But in the last 10 years, there's been a convergence. That's been scaring us because we don't understand that. When you look at the numbers further out into the 2000s, what we see is a trend starting to come down again, but it's less use in whites as opposed to the other groups. The other groups are staying steady or starting to increase again. And what we're seeing is that the use among whites is decreasing compared to all of the other groups. So we're here meeting about a disparity where the overdose rates for one group is going up. And I just want to illustrate that in these dynamic things that are happening with drug abuse, addiction, drug use addiction, alcohol, marijuana use, there are some very, very dynamic things that are going on that may be particular, and back to your point, may be particular to certain communities.
Don, could you repeat the question? We had somebody in the chat feature say, can you give whoever's asking questions
Yes.
the mic? So do that. But what we're going to do is let's hold we want to get to sharing the folks on the
Okay,
panel to share their stories. I know you've got, or Mary, you wanted to say something. Okay. So with that, Jermaine, why don't you grab the mic? You're going to go first. Yes. And we'll go from left to right.
I was really hoping to go last so I could just say we're out of time.
Okay.
But so first of all, I'd like to say thank you very much, Dr. Vereen, for coming and sharing this information with us tonight. You too, Rita. But one thing for sure, I never thought that I would be sitting at the table with the former deputy drug czar for multiple presidents. Like that is just an amazing thing. And we're all here sitting in a room with him right now, learning from someone who is a true professional, a true expert in everything that he's presenting, you know? That is what he does. That's crazy. Thank you. Thank you very much for showing up. But one thing that I would like to say is that I have spent a little time doing research in the field of addiction. However, I am not the expert that most people at this table are. So I'm not even going to present any data because I believe I'm going to leave that best to the professionals. And I'll just speak about some experiences that I've had and some questions that I've pondered, and hopefully it can be addressed as it goes down the table here. So as I've mentioned before, I am a person that is in a recovery, and I grew up on the west side of Detroit, went to the military when I was 20 years old, came back, and that is when my drug use really started, period. However, previous to that, like alcohol was a major component of my life, and it didn't get any better, right? When the opportunity struck for me to relocate from Detroit and come to Ann Arbor, Michigan, I had already done about 11 months or so at a 3-quarter house in Detroit, Michigan. It was not in the best location. The guy who ran it, greatest intentions in the world, and he does a great job. Anything that I say tonight is not an attempt to take away from the service that anyone puts in anywhere, because all work is good work, and there are plenty of people who are doing nothing. So I applaud everyone who is trying to put in effort. But just the location was terrible. We had a drug dealer living directly next door to us, right? And when I came to Ann Arbor, which is completely different than Southfield Freeway in Chicago, there was still a part of me that wanted to go back. And it like not necessarily for like to indulge in substance use, but just because it was different, it was too different, it wasn't for me, I didn't fit in, and none of these things were true. But I mean, I had a whole community in Ann Arbor, Michigan that was welcoming, but I didn't want to be a part of it for some reason. And I left. And now that I've been in this process for longer, and I have the opportunity to own a transitional housing company, and I get to see people of different races move into my transitional housing company from different areas. And the numbers are reflective, the numbers that I see. Now, mind you, this is not a research study, this completely, random selection and things like that. This is just the numbers that I see. They really do reflect the numbers that we saw on the chart, not for the high school students, but for the adults and the overdose rates, the EMS engagement, things along those lines. People who come here from different areas, people that are of color, they don't last as long as I would like to see them last. And I ask myself why, right? Like, is it because that there's a change that is this difficult for someone to adjust to? Is it because the treatment centers in this area are different than the treatment centers that they are used to, like in Wayne County? And I'm also a peer coach in Wayne County, so I have an opportunity to assist people in going to treatment on a consistent basis. And I can tell you that there is a drastic difference in the level of care between the treatment centers that are in the inner city versus those that are in suburban areas. So that is completely separate from the experience that I see at my sober living company. But I gotta ask myself, just like, is that part of the prism that affects the overdose rate, the non-fatal overdose rate, the EMS engagement? Is it the level of care? Is it the population? When I say the population, I mean the number of people in a specific area that affects the level of care that's available to people in inner cities, which is primarily going to be people of color, right? Then I have to ask myself this other question, because I saw that line dipping up and down, right? And I am personally a documentary junkie, right? Maybe I shouldn't use that word here. but I love documentaries, right? And one thing that I saw on a documentary, and I have Dr. Vereen confirm the truth of this, but the drug use rate over time went up and down as the purity of the drugs went up and down, right? So I kind of have to ask myself this question: are the drugs pure in the inner city than they are the further you leave from the source? Would that affect the overdose rate? I don't know the answer to all of these questions. So I'm very happy that this is just the first conversation. And Dr. Vereen, thank you very much for coming in and asking that question and making the statement that says the numbers tell a story. We can collect numbers all day, we can collect data all day, but if we don't ask these questions, we don't know what those numbers mean. I've worked in the research lab where we collected numbers. We had a question that we asked, and we collect all this data, and then we say, well, that chart doesn't look good. Let's come up with a different question. Right? So please, I would suggest that everyone take the data with a grain of salt, but more importantly, listen to the questions. Think about the questions. Ask other people that you know that are not here tonight, because I'm looking around the room and I see so many substance use professionals. People have access to the story. People who could email and say, hey, this is something that I found out. And then Rita can take that information and work her magic with it, So I hope I shed a little bit of light, a little bit of insight on what it is that we're doing here. But now I'm just gonna pass it down to the really smart people in the room and hear what they have to say. So thank you for letting me be here.
Thanks, Jermaine. Crystal?
Hi, everyone. So I needed something to write with up here because my brain was just spinning. I've got so many things going on in my head, like so many anecdotal things, but academia is still a huge part of my life. And so I'm looking at that and some of the answers to some of these questions. Like you said, the question comes and then the answers, or does the answer come before the question, right? Some of the things that came to mind, one of the things that I'm studying right now is the intersectionality of trauma and substance use, right? And we know that if you're familiar with the ACEs study, we know that ACEs study has a lot to do with coping mechanisms. We know this, right? But we also know that the ACEs study was done primarily on white people. So we know that's what it was done. However, when you turn around and put it into the Black community, those ACEs numbers doubled, right? And so you have to look at that. The other thing that thought about was my own personal experience. So I'm from Detroit too, like around the corner from this guy, right? And I remember growing up, everyone used something. Like I didn't know anyone that didn't use. Like it was the thing to do, and like it was weird for you not to use. Like it was almost like a coming to pass type of thing. So much so that when I went into treatment in 2011, I hope Jason is watching this, I did my assessment with Jim Ballmer, and he asked me, so what do you want to do? And I said, well, I just want to learn to smoke weed and drink like everybody else. And he was like, come on in, pack your bag, bring your stuff in. We got a place right for you. One of the other things that really stands out to me that I see in my own personal work that I do is that the length of stay in treatment, right? So if you think about first of all, if we put parallel cancer, for instance, right? Cancer or diabetes, and we parallel that to substance abuse, right? I remember going with a friend to the clinic that got diagnosed with diabetes. And before he left, he had an overkill of nutritionists and dietitian and all these other supportive people that were going to be in his life now without his permission. Someone that was going to be following up with him, someone that was going to be helping him to learn how to eat. He had access to free training and all these things, right, to help to be supportive. But when I got here, when I got in trouble for addiction, I got a DUI and then I got a possession charge. No one looked at the fact that I was, 23 years old and had never been in trouble before, right? No one looked at any of these things, right? They were like, oh, just cuff her. The other thing that really stands out to me is one of the, you're my new hero, Dr. Vereen, just let me say that. But prior to you, Bill White, if you know anything about him, so he talks about the healing forest, right? And essentially what he says is that, and let me just say this, let me give credit where credit's due. It didn't come from him, okay? It came from a minority group, Native American minority group, but I don't want to misspeak, but I got it from him, right? So what the healing forest anecdote is that if you pluck a dead and dying tree out of a forest of dead and dying trees, and you put them in the forest with living trees that are nurtured and loved, and they get rain and they get sun, what happens to the tree? It lives. So after it starts to live, if you pluck it back out and put it back into the dead forest, what do you think is going to happen? Absolutely. And so one of the things I think that we can start to talk about in conversations is like, what do we do after treatment, right? Why is it that people and I don't know this statistically, but anecdotally, why is it that people that go to Dawn Farm have a stay sober? Why is that, right? Is it because they have 90-day treatment? Is it because of the aftercare and wraparound services? Is it because of all of those things? These are all like answers and questions that kind of go through your brain on a regular basis, right? And so a little bit about my story is I had finally had it. I went and looked online. I called this number. It was like 2:00 in the morning, and it was a woman on a horse. If drugs and alcohol are a problem for you, just call this number. So I called and the lady was like, yeah. So I was like, do you take Medicaid? And she was like, yo, no. I was like, well, how much is treatment? She's like, oh, $50,000. And she was like, well, we have a payment plan. And I remember thinking, like, you don't know anything about addiction. Lady, if I had $50,000, I certainly wouldn't be on the phone with you. Right. My experience was that from Wayne County, I called Washtenaw County. This is my first and only time. I called Washtenaw County. I called the farm and I talked to a young lady. Her name is Issa. She's a human being that I adore from this point forward. I called her and I said, hey, I want to go to treatment. And she was like, okay. She did the little intake and she says, well, it's a 6-month waiting list. Then she said, you have to call and check in to keep your name on the list. And I remember thinking like, yeah, okay. Let me tell you, that call happened on a Friday. I got a missed call from the farm on Wednesday. I didn't call back though. A couple days later, I called back. I talked to Issa again and she says, we have a bed for you. You just have to be here on Wednesday at, 8:00 in the morning. I had no idea what I was getting myself into. I had never been to treatment before. I didn't know that what treatment existed. And just to fast forward to that, now here I am with 11 years clean. I face stigma from the people in my community because I don't use, because I operate and I choose not to use drugs and alcohol. And so I have that defeating that stigma that comes back on me that, oh, you think, you think you're better than everyone else. And so these are some of the things that I think that we have to look at when it comes to people of color. In my community, right? It just is not normal for you to not use drugs and alcohol. It just isn't. It just is not. Like marijuana, like everyone smokes marijuana. It's very common for you to sit in your car. And so in my private practice, I work with a lot of courts, people that get pulled over for DUIs and now OWIs. More often than not, it's a young man, more frequently a young man of color. He comes in and he's angry that he got this ticket. Why? Because marijuana is legal. You still can't drive under the influence. Right. But they don't tell you those things. The police are, sorry, Derek, the police can still, pull you over. And we also know that there's still that profiling, right? The other piece to that before I run out of time, and it just slipped my brain. Hold on. So the other thing I see in my private practice is staying sober and trying to find where you fit in when it comes to NA or AA or self-help or mutual help groups. I put an ad in Psychology Today for myself in my private practice, and immediately my phone started ringing off the hook with all of these people who specifically asked for a woman of color. Only a portion of these people were Black though. These people were like, we just want any color. I don't really care, just non-white kind of thing. And so I have this sort of influx of people that are coming to seek these services who are dealing with these sort of traumas, dealing with this intergenerational trauma. It was one other thing that I wanted to say. I don't know. It slipped my brain just that quickly.
We can come back to it,
Okay.
Crystal. Yeah, no worries.
Oh, that's what it was. So just kind of going back to that and the intersectionality of trauma and substance abuse. You can't talk about drug addiction without talking about trauma. You can't talk about trauma without talking about drug addiction. For me, drugs and alcohol were my solution long before they were a problem. Drugs and alcohol didn't become a problem until I started getting arrested. That's when I was like, oh, and then even then it was the cops' issue, wasn't my issue, right? Substance abuse is what got me through life for a long period of time because of my trauma, because of trauma that I suffered.
Wow, thank you. That was awesome. I can relate to what you said about trauma and drugs being the solution. For me, I grew up in a home where substance use was in my home, every member of my family. And I didn't necessarily use because I wanted to have a good time. One, it was there. That's just how I was brought up. And I wanted to use so I didn't have to feel the pain of my trauma. I wanted to be numb. And then eventually when I got out of the house, got on the streets, started having fun, got in trouble with the law, and had a lot of other problems. So one thing that I heard is looking at data, who are these people? And the thing that stands out to me is hearing about white people overdosing or using. And as you mentioned, our government classifies Arabs as white people. So who are these people in our data? I think it would be beneficial to look more into that to see accurate representation. Representation matters, language matters, and we need to talk about that more. One thing that I have seen is University of Michigan using what's called the MENA box, Middle Eastern, North African box. I think that that would be something that could benefit and help better represent us as well. But the question is who do we talk to get that done? And how soon can we get that in? And then once we get that data, what do we do with it? You know, and I think that's where you guys come in, you know, with the research and data. So yeah, and that's what I've got as far as my part as well. But I will say that, you know, I'm very grateful to be here. I'm very, very grateful that I can represent the Arab population. But I also can say that I don't represent the entire general Arab population. I don't think that this topic is talked about enough in the Arab community. And I just want to kind of break the ice, you know, for anybody that's in fear, like, you know, use me. And if you feel like I'm not representing well, come join this discussion because it does need to be talked about more. So thank you.
Jasmine, thank you. And I, you know, before we go to Derek, I can tell you that I was exposed to the stigma in the Arab community when Larry Burns from the Children's Foundation interviewed me and Dr. Chad Brummett from the University of Michigan. And he introduced me to a gentleman, I can't remember his name, from the East End of Dearborn. And Larry Burns told me, you got to get to know this guy. And he introduced me. Then he shared stories with me about the shame that the parents of kids who had died from an overdose felt over their use of drugs and trying to change death certificates from overdose to something else. And so, Jasmine, I just want to thank you, as I want to thank everybody for being on this panel, but, you know, appreciate you being here. Okay. Thank you. Derek Jackson.
So I had all these great notes. I had to miss the warm-up session, so I didn't get to see the data until tonight. And as soon as it happened, I'm glad I had my scrap piece of paper in my pocket because I had to write down so many things. But even as I wrote that, I want to take us back to the very first question that got asked, because that changed what I was going to say about today. And think about the conversation we were just having. It started out with negative data around Black community overdosing at a certain particular rate. And then the doctor showed some other data that really talked about, we also need to ask the same question around what are some of the positive things. And just think about this for a second. Is it impossible that maybe there's something good in the Black community where our kids are not using drugs at a young age? Then why is it that the first question is to question not any of the other data, to question the one data point that shows something positive about Black folks? And I don't say that to pick on the person who asked it, because I was thinking some of the same exact questions. But could it also be possible that there's a parental impact of this? That there's correlating data that says, I've seen in the 90s, crack ravaged the Black community. And that was also the time where teenagers in the Black community were using the least. We see that in the white community, it's starting to go down in the 2000s. Well, the heroin epidemic started to ravage the white community. So maybe our kids are watching what's happening to our adults. And at that time, at that young age, are saying, I'm not there yet. So I just wanted to put that out because when we think about donors, there's these data points out there about people who donate money. And we have perceptions of who might have money and donate to nonprofits and churches and philanthropy. But do you know the race that donates the largest percentage of their personal wealth? African Americans. About 11% of their personal wealth. Not more money, because it doesn't necessarily mean we have more capital, but a higher percentage of the wealth. But we don't think about Black folks as donors. We think about the opposite, not having a lot of money. Do you know who, as a percentage, sends more of their kids to the military? African Americans. But we don't think about patriotism and think about Black folks. We think about patriotism and white folks. And the last one is this great study out there that looks at toddlers and asks fathers, toddlers and infants, and asks fathers, how many of you are changing diapers, feeding your baby, spending time with them? And guess what? African American fathers score the highest on that study. But we have these perceptions. And I raise this because these perceptions might be, just might be, one of the same reasons that we struggle to really engage with communities of color. While we criminalize people of color who use, and we pathologize white folks who use. I, in the jail, see it all the time, right? The biggest example of this is the crack epidemic and the marijuana. I am happy folks are making money, but it actually disturbs me to think when I was younger, I watched friends, family go to jail and prison for selling marijuana, and many of them can't get a job at something they were really good at, working now in the legal business. The stigma. And I'm not someone who's in recovery, I'll just say I'm a Black man in America, I'm a social worker, I'm a police officer. I hire a lot of folks who are in recovery to do this work. And I fell in love with a beautiful woman who's in recovery. And that's when I really learned about recovery. But I'll just say, I'm not an expert on the data. I just know what I feel. When I have outreach workers, who many of them are in recovery, and my Black outreach workers don't speak the language of recovery, haven't most of them gone to traditional recovery, although they're all sober now. And my white outreach workers can sit around the table and they can recite the big book and they know the program and they talk about Dawn Farm, Home and New Vision, and all these other services. I started to ask the question, which is kind of how me and Mario met. Why am I even seeing this amongst our staff that are in recovery? Again, they're all sober now, but they have had very different experiences with sobriety and with treatment. And I could talk all day about this, but the last one, and I don't know the answer to this, but I do know that many African Americans in our jail is where they get introduced to treatment. So if I'm someone who's white and I get introduced to treatment in the community, through friends, through family, through traditional treatment, I have a whole different path to treatment. If I'm an African American or a people of color and I get introduced to treatment through the jail, first of all, I'm sentenced to go to that treatment, but I also have a very different entryway into treatment. And I don't know the specific data. Someone has shared it with me in the past, but that would be another question I would ask. And then the final point I would make is that having representation, having folks who are in the workforce who can help people who look like them. Culture matters. Differences matters. Folks present very different. On my staff, when people are around our table having a conversation, they are presenting different. And if there's a person who's at a treatment facility and they're of color and they're really struggling, a young African-American male, it may not be because they don't want to be sober. It may not be because they don't care. It may not even be because of all the trauma that they are dealing with. It might be that they just don't feel like they fit in. And I can tell you, as someone who also grew up in Wayne County, Washtenaw County is different. Of all the great things we have in this community, and I stayed here all these years later and I love it, I really do. And it is one of the best places to raise your children. But guess what? There are some differences. that the wide gap between the haves and the have-nots in Washtenaw County is ever present. You see it and you feel it. The university, the great research that gets done, so many educated folks, the housing market. There's a reason that we are one of the most economically segregated communities in all of America. There's a reason why we struggle with upward mobility. Poor folks moving into not being poor. We struggle more in Washtenaw County than almost anywhere else in the United States. And so I just wanted to say a whole bunch of stuff that got lost as we started having the conversation. But I really do just want to bring us back to that. We all struggle with this. The idea that a Black person is not a criminal for using versus a white person, we still are struggling with that, not only in Washtenaw County, but in America in general. So I will end with that, but I think that that is a part of the reason of why the data is as it is to this day.
Thank you, Derek. Yeah, go to Jermaine, but I wanted everybody to know who might be zooming in. Feel free to put questions in the chat feature. And we are going to make certain that if you have a question and you're here, you get the microphone so that the people streaming on Facebook and zooming in can hear, because we had somebody kindly let us know that when someone's asking a question, you, Dr. Smith, we should have given you a microphone, and we'll do that going forward. Okay, so Crystal, go ahead.
So I got a piece of paper, right? 12 seconds later, it was full. So many thoughts. So one of the things is I wanted to point out, and I teach at the University of Michigan in Eastern. I teach social work, and drug policy is one of the courses I teach. And one of the things that I'm really hyper focused on is the disparities between the crack epidemic and the heroin epidemic, right? I'm sure people do know, but heroin was an epidemic at some point too. Lots of vets coming back, they were addicted to opiates overseas. They come back, they're steady addicted, right? But all of a sudden, one of the things that I thought was quite odd, I guess, for lack of a better word, if you have an opportunity, I want you to Google Nixon, Reagan, and Obama. All three of them made their sort of policy or their conversation as it relates to drug policy. Nixon wanted sort of public health. Reagan was like, put them all in prison, no matter what. And Obama had Macklemore on his and tried to make it into this sort of public health thing. And so that was one of the things that came up when you talked about it, is the public health issue of another thing. So as a social worker, I'm looking at the DSM, and it used to be when someone would come to us or I would look at medical records, it would be substance use disorder. All of a sudden, it was opiate use disorder. And I was like, well, that doesn't make sense, because I've never met someone who only used opiates. Like, I don't know anybody like that, right? And so that was one of the things that really stood out to me, was how they're starting to now kind of even within the drug population, we're still going to stigmatize. We're still going to say that opiate use is far better than crack use. Right. One of the other things that my counterpart over here pulled out was that a third of overdose deaths are overdose on cocaine that is loaded with fentanyl. So what that tells us is that opiates are a problem, but so is cocaine. But where is the roar for that? Like, where is the roar for that? Where are people saying, hey, this is an issue? One of the other things that stood out when Jermaine was talking about Washtenaw County and just what it is I think about the culture of recovery. And one of the things that I've noticed here in Washtenaw County that I haven't seen in other communities is the culture of recovery, right? When I talked about that healing forest, like nowhere else am I going to sit here with a felon, gun-toting, drug addict felon next to like these two men down here, right? But this community has allowed us to kind of come together. Like you have these businesses that are willing to take a chance on someone in recovery, right? I've noticed here, I don't know if you've noticed here, but if you go in the city of Detroit, there's a liquor store, a weed dispensary on every corner, but there is no library. right? And so you have to bring those things up. You have to look at those things. You have to look at more than just the drug use, right? The use of drugs, it oftentimes is the end of the story, right? But what about the beginning of the story, right? Where is all the fuss there? I live in a community here in Ann Arbor, and they talked about putting a dispensary on, and all hell broke loose, right? Whereas in Detroit, there's literally one on every corner. And if you drive down 8 Mile, you got liquor store, dispensary, and nude bar. I mean, like it's almost like the world is set up against a certain population of people, right? Whether it be people of color, whether it be people the have and the have nots, like low socioeconomic status, like regardless to what it is. I think that the first thing that needs to be done is to make certain that we are noting those differences and noting the ways in which we even talk in the language that we use. What else was it? And the last thing I wanted to show, so one of the things I've been noticing, so I teach a class at U of M, and it's one of their pod classes, and so most of the Canvas site and most of the information is kind of fed to the facilitator, and then we kind of go off on our own. And all of the articles that they pulled up, that they used as sort of teaching tools, I think it's quite interesting to know that this empirical data that we're looking at oftentimes is written by a bunch of white men, right? That the data and the data points are really hyper focused on white people, where there's nothing wrong with white people. I just think that oftentimes people of color, we operate differently. And that's okay, right? But I think that those just are some of the thoughts of the disparities that really stood out to me. Okay.
So, you're okay. And then we got a question over here.
All right.
We're going to start taking questions. Jermaine, Rita wanted to chime in with something
Oh,
before
yeah.
you go.
Go
Rita?
for it, Rita.
Thanks, Mario. I just wanted to comment on, that like all of your stories are important, and at least I see data as like a megaphone for your stories. There were some comments about how long people have to wait to get into treatment. Like we have data on our dashboard about that. And something that's like really important to me is kind of marrying anecdotal information and narrative with data, using data to empower and support voices and anecdotal information. Like you all know what is going on and the problems and the solutions. So like use the data to apply for grants to implement those things that like to be true. So I just hope that everyone sees our team as like support, that I feel it's our job to be listening and supportive, and that we're like here as a resource. Anyway, thanks, Mario.
Thank you, Rita.
All right,
Go
thank
ahead,
you, Rita.
Jermaine.
So it was something else just crossed my mind, and once again, it's just a question, right? I don't have an answer to this, but tonight we are discussing overdose rates, correct? So we're discussing overdose, and something that I pointed out here that Crystal read earlier was that 1/3 of all overdose deaths, at least in Washtenaw County in 2019, was cocaine laced with fentanyl, not intentionally using fentanyl, but cocaine laced with fentanyl. So if you take that fact and you understand that the vast majority of the funding in the substance use field is going toward people whose primary drug of choice is an opiate, if there is, which I don't know if it is, you would know this better than me, Dr. Vereen, if there is a disparity simply in primary drug of choice between races, right? Then you would have a disparity and the amount of funds that are being utilized to treat people, therefore having all this 1/3 of people who overdose on cocaine laced with fentanyl going left unattended to. So does that make sense to anyone? All right. So I guess the question is like, is there a racial disparity between primary drug of choice when it comes to cocaine versus opiates? And that can be answered at another day, but I just thought that'd be a very interesting thing to look at. So do you have the audience have a
We
question?
got this gentleman right here, and then we'll come back over here and over here.
All right, I'm taking all this in. I just wanted to share my experience a little bit. A question was brought up about stigma and things being hidden, not wanting to be talked about in the Black community. I don't think it's necessarily that. I'm an ex-convict, right? I'm an alcoholic. It's been my experience when I go to the county jail, or the years, the decade and a half that I spent in the Michigan Department of Corrections. I'm not a mathematician, but the majority of people were there that they were Black. Okay. I had the great opportunity of getting into treatment thanks to Washtenaw County Sobriety Court, FAN. I was able to make it to Don Farm treatment. And when I was there, I was like, for a minute, I was the only Black guy there. And a few more came through. The majority were young people from wealthy white families. That's a fact. Now, it's a beautiful thing when I make it to the tables and make it to the meetings. Here, this recovery oriented function. Everybody's here. The addiction, the overdoses, the stories of recovery and success in recovery and people getting their lives back. It doesn't know color boundaries. All right. That's my observation. It's not that, the numbers are off because people are not coming forward. It's from my observation, when I go to the drunk take and the majority of the guys there is from the hood and maybe Danbury Green or Southside Ipsy, whatever. And they talking about, what you get hooked up on. And it's I was drunk or I was high or some kind of domestic or and the addiction or is not the issue, and we're criminalized and sent through the system, and it's not like a thing where, oh, you're here, you should get help. That's been my experience. I'm 50 years old and I've been dealing with this shit for 30 years. Okay. I think the hard question when it comes to looking at the statistics, the issues that we really got to address, is ourselves as a society, the race issues, the things that's popping up in the politics, it's there. The things that we want to ostracize and ignore. We want to get to the real truth of these numbers and statistics. We got to look at that shit too. That's all I'm saying. Thank you.
Hey, thank you. And, I'm glad somebody told you to come.
Okay.
I'm serious. Okay. Thank you for coming. What's your name? Your first? Russ. Thank you for coming, Russ. We had somebody up front. Cheryl? Hi. Yep.
Hi, I'm Cheryl. I'm an alcoholic in recovery. My husband died of end-stage alcoholism, and our son struggled with pills in high school. What I heard when the panel was first introducing themselves was the word prevention by Dr. Vereen. And I'm looking at, this tablecloth, educating communities, and Crystal touched on it. Like, we're talking about the end stage here, like death, potential death and overdoses, but we got to dial it all the way back. It's very much socioeconomic. And so where does this all start? And you were giving statistics about seniors in high school, but how do we get into these schools when they're in middle school? Because as an alcoholic who did have the opportunity to go to treatment, that's one of the first things they ask is, when did you take your first drink? And for most people like me, it's like 13, where you're trying it out. And luckily I was able to go to treatment, and life is very good now. But yeah, I'd be interested in doing, a panel discussion about early education and how do we stave off, problems. It's very much a family disease. So educating yourself, before you ever take that first drink or try that first drug. And, nowadays you potentially you could try a drug for the first time and die. That's just the reality. So I appreciate all of you here today. Thanks.
Good. Okay. Yeah. Right over here to Katie. Go ahead, Katie.
Thanks. I appreciate all the points everybody has made and for being here tonight. It's been a great discussion. One of my many observations, though, is that, and Crystal alluded to this, Derek alluded to this, but nobody has used the term racism. We're talking a lot about racial disparities and socioeconomic status. But like Crystal mentioned, you said something really powerful. It's almost like this country was founded against a certain group of people. And so when it comes to substance use, particularly in Washtenaw County, what are we doing? My question is, what are we doing to prevent this from happening in the future? Like Derek was talking about the disparities between Ypsilanti and Ann Arbor versus Pittsfield Township. We see these differences, but it's not an issue of race. It's an issue of these policies that are rooted in racist beliefs that nobody seems to want to talk about. And so I'm curious what we can do moving forward in Washtenaw County to prevent this from happening in the future, and how we can continue this conversation in a more realistic way while addressing that issue.
Dude.
Thank you. I'll just take a quick snippet of this. Speaking about law enforcement and the intersectionality of people getting involved with the criminal justice system. So the question is, what can we do or what should we do? For a long time, there was no option, even for an officer on the road. If you see a drug or paraphernalia, you take enforcement action. What we've built and what we've done now, because I think we know better, we do better, is what are all those off ramps? We realized, and we started talking about this really 14 years ago when I started the sheriff's office, which was, if you are arresting people for these issues, you're not actually dealing with the real problem, right? Like locking someone up in the jail because they are suffering from addiction is not the answer. So what we started to do was, all right, an officer who comes into contact with someone over and over and over because of what they perceive to be addiction or mental health or even just extreme poverty, now there's an off-ramp, something called LEAD, law enforcement assisted diversion. So I don't have to take you to jail. I can literally say to you, today in Washtenaw County, I can say this to you. I can either arrest you or I can connect you with a social worker. What do you want? Now, most of the folks are going to say, where's that social worker at, right? And then the only thing you have to do is have the conversation and the assessment with that social worker. And the reason that I was going to arrest you in the first place goes away. And when I say goes away, literally goes away. Now, that's not for everything, right? If I'm going to arrest you for a serious violent crime, sorry, like you can't do this. But for some of those smaller, lower level things, that normally would be a trespass after this, or this after this after this, that would wind you up in jail. Now we no longer have. The other thing that we do is we have a co-response unit. So literally having an officer and a social worker together, but even getting further upstream. So you don't even call an officer in the first place. So again, I said I'll be brief, but for us, this is just my role in law enforcement. My one little sliver of this equation is, how do we create all these other mechanisms so that an arrest doesn't have to be your way entering the system? So when we talk about racial disparities, LEAD was founded in Seattle because of racial disparities. So many Black folks in Seattle streets were being arrested for paraphernalia, when, if you've ever been to Seattle, you can see it is not an overwhelmingly Black city. There are open drug use, open drug markets of white folks there. And so you would think that the data wouldn't reflect it, but they were overwhelmingly arresting the Black folks for doing the same thing. So LEAD was brought to Washington County for this exact reason, to deal with the racial disparities around arrest and drug use.
So I would, we got a question here and then one over here. But I would offer to you, Katie, as a part of these ongoing discussions, if you're interested in being on our panel next time we talk, or whenever it is, we'd love to have you. Okay? So.
Hello, everyone. I'm Sierra again, and this has been such a great meeting. I feel like I didn't share enough about myself in the beginning, but I still consider myself in early sobriety. My sobriety date is December 18th. 2020, so I'll be having 11 months coming up. But like what we discussed, I grew up in a family where there's a lot of drug use. No one really got help. I'm the first person in my family to actually get help. And the only way I was introduced to like, AA or whatever, or rehab, because I got an OUI in 2018, and I was sentenced to 30 days in jail, and it was my first offense. So like none of my family knew information about how to get help. I think a lot of it has to do with past trauma, which information was never delivered to them. And even if so I set an example for my family myself, and I have a lot of alcoholics and addicts in my family. But even though they have the information and support, it's like, why aren't we using it? Is it because I'm Hispanic, and in my family, we take a lot of pride in basically trying to figure things out on our own, and hard to ask for help. So when I was involved in alcohol and drugs, I didn't know how to ask for help. And I felt like my family thought that I could deal with it on my own without anybody's help externally. So the question is like, even though in the Hispanic families, even though we have the support, why aren't we using it? Is it because we have too much pride and we don't want our families to look down upon us? Because we are asking for help and trying to heal trauma within the family? So that's a good question to even because I want to get into clinical research with addiction. So coming to this meeting, I'm able to go back to my university and get connected with people and PhDs in clinical research to find information out more about some of these statistics that we have been seeing, so we can further on more information and studies and get answers of why this is exactly happening. So thank you.
Thank you for that. We're going to have one more question and we're going to wrap it up. Okay?
It's more of a comment, but
Oh, okay. Go ahead.
my son is the original reason why I started with Families Against Narcotics at freshman year at U of M 5.5, almost 6 years ago. He developed an opioid addiction, almost died. We got him into a great treatment program out in Texas. He's now almost 5 years doing well. He's back in engineering at U of T. He told me after we've gone through all this that he was actually, he looks like me. You look a lot alike. He was actually pulled over by the police 3 different times going back and forth between Detroit because he was actually dealing, and we had no idea what was going on. Never got a ticket. Nothing ever happened to him because he could sweet talk his way out of it, and he was white. So I just wanted to have that comment out there because after this discussion, it reminded me of this conversation I had with him. It's like, I'm so glad I didn't know about it because I would have been worried to death the entire time that I didn't know about these things. But anyway, there's proof out there to support the racism.
So that's it. I want to thank everybody for coming. And thank you to our panel, huh? These folks are great. Thank you to everybody for zooming in and streaming live on Facebook. Rita, you're awesome. And I just want everybody to know, I'm pretty sure our next meeting is going to be at the Freight House, but if you just go to our website, you'll learn more with regard to whether it's going to be there or here. But our next meeting is on co-occurring disorders and addiction, which is the notion of treating mental health and addiction under the same bucket. Our guest speakers are from the state of New York. They were the subject of a fascinating article in the New York Times that I can't remember the exact title, but it was something like, we already know the answer to the overdose problem in our country. Why are people still overdosing? And their answer was, we're not treating mental health and addiction as one and the same. Stephanie Marcasano, who is a lawyer by education, Ivy League, her son died from an overdose and had multiple mental illnesses. She's leading the charge in that state. And Dr. Ken Minkoff from Harvard, who's a change agent in this area, will be joining us next month. Very important meeting. So please join us. And I can't thank all of you enough for coming. Come next month, please. And again, panelists, and Dr. Vereen, Derek Jackson, Jasmine, Crystal, and Jermaine. Thank you, everybody. Take care.